There guys, it is Ross and I am coming to you today with a little bit of information about fascia. I'm asked often, what is fascia, what does it do, and things of that nature. Also, being that the service that we provide, T3M or Trained Touch Muscle Therapy, is mainly made up of advanced techniques that are really good for myofascial release, this is a very good topic for you to get an understanding of. So we're gonna get fascia. Fascia is a connective tissue that connects your skin to your muscle as well as other organs within the body. And your fascia is pretty much a woven or mesh-like connective tissue that's made up of elastane and different forms of collagen. So the easiest way to envision what fascia is if you've ever cleaned chicken and you see the filmy stuff that's right in between the layer of skin, of the chicken skin to the meat, that would be fascia. That would actually be the superficial layer of fascia. If you want to dive in a little bit deeper to understand the deeper layer of fascia is, imagine when you are like biting into the chicken or trying to pull the chicken apart, and sometimes it's a little hard to do, or pulling it off the bone. That is where the deep layer of fascia comes in and adhering the skin to that bone, not only the skin. So just very small snippet of a summary. Fascia is a connective tissue that connects your skin to muscle as well as your muscle to joints and so on and so forth. So next we're going to get into how fascia can cause chronic pains and what different things can affect your fascia and symptoms to know that there is a possibility of these. Fascia is made up of elastane and collagen. It can be very liquidy or glide or even similar to a glue when it is close to a neutral state of homeostasis and has not experienced any type of trauma or stresses to the connective tissue. Now, where the chronic pain portion comes in is because your fascial layer can dry up very much like glue. When glue dries, it adheres and it sticks together, holding, whatever objects together. That can also happen with your fascial layer. So if you experience any type of trauma, both physically and emotionally, i.e. if you get into a car wreck and whiplash, and anyone that has had whiplash or been into a car wreck, they can understand that their muscles, neck, or what have you, typically are not the same and responsive with range of motion, and that's because that fascial layer has experienced trauma. Also, with emotional trauma, it can cause restriction as well, because the stress within the body tends to form physically over time if we haven't done the healing process of releasing that trauma, like going to therapy or chakra balancing, forgiveness, things of that nature, to really release that emotional stress that we're holding within the body. Also, lack of movement. When you don't move, your fascia as well as your muscles have memory and they start to lock in place. So that's why physical activity is very important. Another thing that can affect your fascia is inflammation, i.e. plantar fasciitis, where the fascia connects your heel to your toes. A lot of the times when it is in a state where it's been affected or binded down, it can cause inflammation. Another thing is poor posture. So those are a few things that can affect your fascia layer. Now, here are some techniques that can also help release your fascia. Myofascial release technique of massage cupping, and a cupping is a myofascial release technique that is thousands of years old, but we use here a Western modality of vacuum cupping, which lifts and separates the layer of muscle to allow for blood flow to come in to the area, increase your lymph flow and things of that nature, and to make your muscles a whole lot more pliable. Foam rolling is another good technique to help release your fascia. Instrument assisted soft tissue mobilization, or scraping, is another good one. Scraping is based off of cross fiber friction technique, and pretty much what that technique is going across the natural direction, or going in the opposite direction of your natural fiber striation of your muscles, allowing for it to break down adhesions or any type of scar tissue buildup. Also, massage of any sort, working with a therapist that has experience with breaking down the fascial layer, or myofascial release techniques are also really good options in order to just break down the fascia. So if any of these things sounds similar, speak with a professional medical massage practitioner, physical therapist, primary care doctor, etc., to get a movement assessment to see exactly what's going on with you, to see whether or not you do have any fascial restriction, because a movement assessment or assessment of some sort, or diagnosis from a doctor, is very much needed also, because a lot of these same symptoms are very similar in muscular skeletal discomforts as well. So it could be fascia, or it could be muscular, or it could even be both. So if you have any questions or concerns about anything, please comment down below. I'm more than happy to answer any questions that you have. Also, if there's any topics you would like for me to cover, comment down below, and I will also cover those topics. So until next time, have a great day, guys.